This is a wonderful time for me to share with you in the middle of a crisis that we thought would be close to resolution by now. But I am Addie Eckardt. I am a psychiatric nurse, advanced practice individual, and I have spent most of my career, as you'll see as we go through the slides, in psychiatric nursing. But now I've spent the last half of my career predominantly in my role as a state senator in Maryland, representing Maryland's Eastern Shore. Next slide, please. So as you can see, I serve on the mid shore. Now, the Middle Eastern Shore of the Eastern Shore has a boundary of Delaware and then the Chesapeake Bay. So most of the counties that I represent, except for Caroline, are touched by tributaries and bodies of water of the Eastern Shore. And those counties are Talbot County, Dorchester County. They're our biggest water surrounded counties, Wycomico County, and then a little bit of Caroline County, which is kind of a landlocked county, except for the Choptank and Marshy Hope rivers that are tributaries of the Eastern Shore as well. I was first elected in 1994, as Manahil indicated. So I've spent a number of years there before I was elected a state senator. And then I reside on the water, as you can imagine. We've grown up living close to the water with my husband, Dick. We have 3 sons who are married, and we have 9 grandchildren, actually. So this is a picture when I had an opportunity to chair one of our committees in Annapolis. Next slide, please. So I graduated. I grew up in Pennsylvania. I graduated from Pennsylvania Nursing School in 1964. Went to the University of Maryland. Well, actually, in '64, I'll tell you a little bit about that. I worked came to Baltimore. We worked in Baltimore, and we were doing full-time Christian ministry with an organization called Young Life while I was working at Union Memorial Hospital there in Baltimore. And as I said, we were employed with Young Life, my husband was, and we decided to go and serve the Lord in South Texas. So we went to South Texas for a year with the ministry with high school kids, and promptly were kind of evacuated with a severe hurricane. We had 3 small children under 3 at the time, and we came back after friends of ours asked us to come back to the Eastern Shore. We did not want to come to the Eastern Shore because back in those days, there was a lot of civil unrest and the riots had taken place, and Cambridge was one of those hotspots where we had a lot of violence. And if you've read about the civil rights movement, you know, Cambridge was right in the middle of that. But we came to Cambridge and raised our children here and got involved in the community. And I began to work at Eastern Shore Hospital Center, which is a psychiatric facility, state facility for people with severe and persistent mental illness. So I worked there and then decided that I wanted to go back to school and get my bachelor's degree. So we were raising a family. I was working full time, and then I went back to school in the evenings, nights, and weekends to pursue my degree, received a bachelor's degree, and then my master's degree was through an outreach program because we had no other master's programs on the Eastern Shore. Salisbury had a bachelor's, Salisbury State at that time, but nobody else had that. So that's why I thought it would be good to go into therapy, particularly family therapy. And I had to get my master's in order to do that. And then I continued practicing at Eastern Shore Hospital Center and doing some outreach clinic work with our migrant community and with our minority, now we would say women and minority population. So I guess I was dealing with health diversity way back then in the early 70s, when I would pack up my bag and go out to an outpost in Hurlock, Maryland, to see patients and clients and families who were not able to come into the hub in Cambridge. And I would take my Prolixin injections. At that time, you were able to take out and go out like we're doing vaccinations now. You can make those kind of home visits and provide those services in the home and in the community. So I've maintained all those years, I've maintained my specialty in psych nurse clinical specialty, and I'm certified by the ANA as an APRN, because I think it's really important if I'm going to be talking about issues in the health field that I maintain my professional credentials and continue to provide part-time service. So I currently have worked with a home care agency called Visiting Angels as their RN, that, as you can imagine, I usually get into activities and behavior issues with some of the clients. Next slide, please. So I actually, you'll wonder, how did a nurse get into politics? Well, I had a friend who said consistently, you need to belong to your professional association. And I was not active with the Maryland Nurses Association at that time because I was going to school and working full time and raising a family. And when I finally finished going to school, I said I would get involved in the professional association. And I did. And because I was willing to drive from the Eastern Shore to Baltimore, that I got involved in the Maryland Nurses Association and became very interested in the political field. I was concerned about helping families get access to health care, because I found on the Eastern Shore that many people just didn't have a physician, didn't go to the doctor, weren't interested in taking care of their health. And if you can think back to the 1970s, to a very rural population with a lot of watermen and farmers, usually somebody in the family had a physician. But if it was anything, and it was a lot here on the Eastern Shore as it was when I was growing up, we used to go and talk to the local pharmacist about what to do for colds and the flu. And and people still do that somewhat today. And that's a good thing, because our pharmacies have expanded their practice as well. So I began to continue my work and got involved with the Nurses Association, and also became involved with an organization that I didn't put up on there called the Health Planning Organization, which was an organization that was local at that time that really did assessments on the community and the community service and resource availability. And so at the same time, I was involved with the legislative arm of the Nurses Association. I continued my community involvement as well. So not only working, but also engaging in the community, because I believed it was really important to give back. I had received so much education and, lived in a very beautiful place. I love Cambridge, but I would always have been concerned about the community and others having access to the same resources that I have. Next slide, please. So I continued that involvement as a legislator, as a community activist. And somebody said to me in the Nurses Association, Addie, why don't you run for office? And I said, I'm not going to run for office. I'm politicians, I'm not real impressed with politicians. This was back years and years ago. Well, as I was working at Eastern Shore Hospital Center, one of my patients who has severely schizophrenic, to the point of being very threatening to his family. I was working with him, and I'd frequently be the nurse working night duty when they would bring him in after he had made some very, very profound threatening gestures to his family. So I got to know his family very well. And one day his mom took me aside and said, Addie, why don't you run for office? You are interested in the community. You're involved in the community. Families here. I need people to be involved. And it's really important that we maintain our two-party system. And I'd like for you to get involved. And I thought, I can't do that. But after she worked on me for a while, I got involved between she and another older nurse who was kind of directing our local hospital at the same time, kind of ganged up on me and pushed me. And I said, all right, I'll think about it. Well, I ran for the Central Committee back in 1986 because I'm a person that believes it's important to work up through the ranks. I think once you're able to know all aspects of the job that you are either performing or asking others to do, you should be able to do that yourself. And I value that. So we started at that level, and I had worked creating the health planning system. So I said to people, I work full time. I can do your procedures and policies. If I get elected to this job, I can set up the organization. We can fundraise. I know how to do that, but I'm not going to be able to be out on the ground, knocking on doors, meeting people as much as you all are going to be able to do. I wound up being the top vote getter on that election, and then was the president for 8 years, 2 terms of that organization, as we recreated a two-party system in Dorchester County. Before that time, it had been predominantly one-party dominated, and people who wound up, who ran for election were friends of friends, and it was a very established, predominantly male driven organization. And I just thought it needed to be shaken up. And when my husband and I came to town, we didn't fit the mold because I worked, and a lot of times he was home with the kids, and we've just shared our responsibilities in our family. So we were a little bit unusual for the Eastern Shore, which was pretty traditional. But, getting to know people, and in my psych work, and we won't see a slide on that, to me, it's really important to develop a lot of interpersonal relationships, building trust, creating a climate of acceptance, and then identifying and solving problems. I mean, that's just the basic nursing framework that I bring. And I think that there is a lot of opportunity in the community to do that. So I ran for office again after serving 2 terms on the Central Committee as the chair, and I lost my first office. My first election in 90, I ran for the House of Delegates, and I lost that time, and I thought, I'll never do this again. But lo and behold, in 1994, I ran and was elected. Of course, I was very nervous, very frightened at that time, but I did it anyway. And it was a very exciting time because we had the opportunity that first year. All of us were new. It was the largest class in the largest freshman class in the Maryland legislature. So we took a tour around the whole state, which was a great opportunity to go from, we started in Baltimore City, we got on the train, we went all the way to the very tip of Western Maryland to Rocky Gap, and we saw the strip mines and the mines there. We came back into the University of Maryland to see all of the technology. We went to community colleges, we went to wastewater treatment plants, we went to prisons and hospitals and performing arts venues. And we were on boats and buses and trains, and it got a lot of flack because it was criticized for being an abuse of taxpayers' money. But I can tell you it was one of the best orientations to the state and to the legislature, and a great opportunity for bonding with my colleagues at the time, my new colleagues. And to this day, within the executive branch of Maryland, a number of my colleagues who were elected at that time are very concerned about Cambridge, which is important to me because of all of those good relationships we established back in 1995 to probably 2000. So because of my background, you can look at my committees and see that I wound up on Health and Human Resources. I served in the House. I served most of my time on Economic Matters because we did health insurance on Economic Matters, and folks thought a nurse would be a good person on that committee. In fact, there were two of us. There was another nurse elected the same time I was. In fact, there were three of us at that time. And she was on that committee with me as well, we dealt with actually the first laws that set up the computer transaction code. So we were the ones that developed the legislation that puts the framework in law for how to deal with all aspects of computers and technology and shrink wrap and agreements and all of those important aspects to do business in Maryland. We wanted to be a premier state for technology, and that has held out. I also was very much concerned because I've worked in substance abuse and, community mental health. I was on all of those. And then children, youth, and family, because families and, being with moms through their pregnancy and childbearing and those early years are so formative for brain development for little ones. That, of course, I've taught psych for years. We know that it's really important to give a good foundation to all of our children. So again, I bring that with me, and I try to champion those issues as well. But because I'm a little tight with money, folks thought that it might be a good idea that I go on the budget committee. So I was appointed to the budget committee after my 8 years in Economic Matters. And I remain on the budget committee to this day, making sure that we oversee all of the funds that come into the state to see that they are used wisely, that they are balanced, and that we are able to have a sustainable economic base in Maryland and on our Eastern Shore. I've had the opportunity to serve in leadership in a number of ways, both as chair of the delegation, chair of the caucus, and president of the Women's Caucus as well, the Women Legislators of Maryland. Next slide, please. So again, you can see this is a photo of that was just taken this year. Of course, you can see it's very COVID sensitive. All of us at this point, at this picture, had been vaccinated. This was a very unusual session for us. And I didn't put a picture in here of what we look like when we all go to the Senate floor, but looks like we're in little fish bowls. But let me just go over, you can see again, some of my committees are similar to what I did over in the House, except I've also been able to serve on a number of environmental committees as well, looking at preservation of land. And I also work, and one that's not on there, I'm with the University of Maryland School of Agriculture and Natural Resources Global Leadership Council that meets quarterly to look at a variety of issues that impact the University of Maryland. So I serve in that capacity. I am also on by appointments, either because of the Senate president or because of the Governor's Commission. I am on the Behavioral Health Advisory Committee, the Governor's Commission on Suicide, the Governor's Commission to Study Mental Health and Behavioral Health in Maryland, and then the Sexual Assault Evidence Kit Policy Funding Committee. And this year, I had 2 more added as if I didn't have enough to do. And that was a very special opportunity to be on the Senate President's Advisory Work Group on Equity and Inclusion. And we produced a document. If you get a chance to go on the Maryland General Assembly website, and I don't know if you can see this, it's the report that came out on that advisory work group with all of our legislative initiatives. And I'm going to ask that we update that with the success that we had this year, because that was, I believe, a really important opportunity and an intense opportunity to really deal with equity and inclusion. I speak about that, Manal Hill, because you have been an inspiration to me. And just being able to recognize the needs of working with vulnerable populations. And we have some policies in Maryland that I believe needed to change to be able to make sure that everybody had access. And I'm going to deviate a little bit, if you don't mind, because as I was talking about the School of Agriculture and Natural Resources, interesting, they just developed a new model and it's called DIRE, D-I-R-E, and it stands for diversity, inclusion, respect, and equality and equity. And they're using that model throughout the university to be able to address so many of the issues that have just been exacerbated because of the pandemic. Access to healthcare, access to capital, access to even basic resources. So that when the shutdown occurred last year because of the pandemic, many people with various cultures were impacted differently. And I would say that our cultural diversity folks are probably most displaced. And so when we went to the budget this year, and we thought we were going to have a severe shortfall, and the revenues held because many businesses were able to continue to operate safely despite the pandemic. We found that there were others that needed a real infusion of funds. And in order to be equitable, those funds and relief were extended to everybody, all taxpayers. And that was regardless of their status. And that was a good thing. And then because of the work group that I worked on, we've also extended healthcare to folks who regardless of their status. So I didn't know if you knew that or not. So all pregnant moms pre-pregnancy will have access to medical assistance. And then through their pregnancy, and I think it's up to at least a year or beyond. In addition to that, we extended those individuals with TIN numbers who paid taxes to take advantage of the earned income tax credit if their income was, I think it was 6,000 or 8,000 or under. So that was a first in a long time. In addition to that, we created an Office of Immigration that will be because, and one of the things that I found in my work with vulnerable populations is there are tremendous issues around language and culture. And there are many, many thousands of people who live in the shadows. And I think we can do a better job of recognizing and valuing all of our cultures. And I'd like to see us all be bilingual, but that's something I grew up with, thinking we all would be bilingual by the time my children were in school. And look, now my grandchildren are graduating from school and they're still not bilingual. So we have much more work to do, because I think that would help things and build translators and enhance the best that each of us bring because of our particular culture. Next slide, please. So I'm getting into a lot of the meat of what I've been doing through the pandemic, which has offered a tremendous opportunity. If you have a healthcare background, this is the time I think we shine. As you and Dr. Shima have experienced, there are endless opportunities to go and serve and care for people. Here are just, and I've integrated a lot of these throughout what I've talked about. This is a picture actually at CASA, which is, there are two different CASAs, but this CASA is the court appointed special advocate. In Maryland, we have an opportunity. Kids don't always have an advocate when they're going through the court system, if they're in foster care or there's some other reason for difficulty with those children. But the CASAs are trained and they're volunteers to be able to work with children and support them through that very challenging process. If there's a divorce or if there's a separation from the family, this CASAs are the support person who get to know and work with the child and then bring that information to the court process, that information. This was just a little, if you see blue pinwheels or silver pinwheels around this month, April was the month of celebrating children. So that's what this little event was all about. But as you can see, I've been a board member. I'm a perennial board member. When I did my my coursework in my undergraduate degree and my graduate degree, I worked a lot with family systems, Bowen theory, and many of those principles I use with me in working with organizations, in many times helping organizations to get untangled. And what I mean by untangled is many times organizations are not always successful. And I think it's because there's not clarity in their structure. There are not clear lines of communication and order. And of course, that's part of what I've done in my role as a family therapist in working with families to look at their genogram, then look at the interaction and communication and various roles, and then being able to clarify a lot of that for better functioning. So I am a member of many of these because of legislation. The Midshore Regional Council is actually an economic development arm, something I got into when I realized that the Eastern Shore as a body did not have access to federal dollars that would allow us to get resources to be able to provide incentives for business to be in a rural area where we have a high degree of poverty and we have more people receiving government benefits than we have paying taxes. So many of our poor counties in Maryland are struggling with these issues, but if we could bring in additional federal resources, then we would have incentives to spur economic development. And that's what the Midshore Regional Council grew out of. Channel Marker is a group that provides psychiatric day program and housing for folks in our population who have severe and persistent mental illness or substance use and abuse. The Eastern Shore Area Health Education Center was one of the first pieces of legislation that I did. And that's a group that works on the Eastern Shore and around the state. There are other AHECs, but they receive federal funding through the University of Maryland School of Medicine to be able to recruit and retain health professionals and be able to provide health care. We do a lot with dental care. We do a lot with orientation. I'm on that board and I've been on that board for 25 years. We do a lot with the dental clinics that we have. They identify where there is a need and then work to provide the resources in addition to recruiting and retaining physicians, physician recruitment. We used to have we've been working to develop a residency program through the years, and we're hopefully going to see that in the next year or two. Sailwinds is a waterfront development committee, so I do get involved in other things beside healthcare. Wye River Upper School is a school for children with special needs who aren't able to be served in the public school system. Very interesting, very holistic and health focused, and does just a tremendous job in working and individualizing curriculum for students that don't quite fit the mold of public school. And then the Harry Hughes Agroecology Center, there's a little bit of my environmental involvement that it's an honor to serve as we look at we're doing a lot of studies on trees and forestry and how that impacts the environment. And we get into agriculture, aquaculture, and new niches for agriculture, soil health. Again, to me, that all fits under the broader rubric of health of the community. If we want to have clean air and clean water and access to adequate wastewater, all of these are really important as we go forward. We saw a significant interruption of our supply chain this year because of the pandemic. And so it's really important that we look at sustainable local ag, and so that we don't have such a food shortage and a food interruption. And then we still spend a lot of time with food subsidy, and food banks is a big thing, and pop-ups. There's a pop-up in 2 or 3 different places on the shore just this morning where there are surplus food being bagged up and families can come and get that. So our food deserts haven't been resolved either. And to me, that's just basic health. So again, currently haven't re-entered the workforce. I'll probably either go back to Eastern Shore Hospital Center because they've already asked, or go back and see what we can do with Visiting Angels. The home care programs really took a hit, as did the nursing homes, with people not wanting to expose themselves to a lot of comings and goings in their home for safety until everybody was able to get the vaccine. But now we're in the middle of a little bit of vaccine resistance. So many of us are on the street, and I was on the street in Cambridge with the team. Our vaccine dream team went out door to door to be able to recruit people to get the vaccine and develop those clinics. So again, you can see I still have a lot of the committees I've carried with me for a long time. And you probably think, well, isn't it time to move off of some of those? Yes and no, as long as we're recruiting and we have changes on a regular basis, that's really important. I think I'm in line now to go up and in the next 4 years be chair of the Women's Caucus again. Just by virtue of hanging in there, I tend to stay with something once I get involved, and because I always find it fresh and new. There's always something exciting and new younger people coming in that I can learn from and share with. Next slide, please. So as you can see, what's really important, my theoretical background kind of hangs out all over the place, as I've talked to you about. One thing I didn't mention, though, I've spent a lot of time with group therapy, various stages and development of group. And of course, when you're working on a committee, you're working in an organization, those same kind of principles take place. But basic is just building therapeutic relationships. And we have a lot of time, and you all probably spend a lot of time talking about those important relationships. And that has to do with building trust. And I pulled a couple of slides from my campaign and my activities here because I thought it takes a lot to build trust. And believe it or not, I'm in the pink boat. I'm paddling away. We won that race. We beat the men, the younger people, which is kind of fun. This is a fundraiser for Special Olympics that takes place in Oxford each year. And I have done this race for years. Sometimes I win, sometimes I don't. I've never capsized yet, as others have. But that's how you build trust. The lady behind me working with me was one of my nursing students who now is doing public health in Caroline County. And we worked together. She went through my psych course and when I was doing staff development, and she also worked at our psych facility, practicing all those and learning all those good skills that she then took with her into the community. And it's been quite an advocate for health. But if you want to build trust and create a climate of acceptance, I suggest that you pick somebody you don't know well, or pick somebody you do know well, and try to win a race and be able to paddle together at the same time, negotiate all the turns, and when all the boats are right on top of you, it's a great opportunity. But building trust. The ladies, we were celebrating the women's right to vote in this picture, and actually Melanie, the lady in the middle, is our president pro tem. And then Sarah is the lady on, let's see, it would be my right, your left, maybe. She is one of our new young senators from Annapolis, and all three of us are on the budget committee. That's why we were all standing there together. But we've worked together, Melanie and I have worked together for quite a long time, Senator Griffith. And, you know, building trust is a matter of spending time with folks, winning the right to be heard, listening, doing what you say you're going to do, keeping commitments, and working on that. And for many people, trust isn't gained easily. And I think there's some of the opportunities we have to build those relationships so that we can really share where we're coming from. And I think that's what it's going to take to be able to make some of the changes that are necessary at policy level and in our communities. Creating a climate of acceptance. I come to this fairly easily, believing that everybody has value and worth and has something unique to contribute. How you bring that out of people, how to accept and be kind, and recognizing that value and worth, and how that's translated is important. And then that gives you the opportunity to do problem solving and teach it and provide those skills to individuals that increase their self-esteem and their confidence in their own ability as they discover their skills and abilities and know what they can contribute and feel important about. Next slide, please. The other one that's really important, again, another one of my psych nurses is in the fancy goggles and boas. Another one of my clinical nurse specialists that we all work together at the hospital. We used to do kind of crazy things. And this depicts that in order to be highly visible and be both comforting and distracting at the same time when you're working on a psych unit of maybe 18 to 20 patients, and my responsibility was the treatment planning and the clinical care that was provided. So Gunderson is a person that I just love this, and we call it the SSSIV or EV, and it's safety, structure, support, engagement, and validation. And whether you use Maslow's hierarchy or you use something like this, to me, people have to feel safe, and structure contributes to that safety. Predictability is really important. Knowing the expectations, not being surprised all the time or having the environment changed around. That is just so important to keep anxiety at a functional level so that people can think and respond in a predictable way. And of course, you can't do that without a certain amount of support, being recognized with value and worth, and supported in encouraging people to use new skills and abilities, and recognizing their engagement, their part of the process, and bringing folks in the beginning of a project rather than delivering it to people, working alongside of a family, working alongside of someone as a team, sharing is so very important, not getting into all the hierarchical relationships. And then validation, which is validating the significance of another's skills and abilities. And moving on, this is just a little award that I received. It's a Jefferson Award. We're talking about this. Jeffersonian is into states' rights, but this is one of the national organizations I stay engaged with. Next slide, please. So there's my cage, there's my little fishbowl, and just want to share really briefly, because I know our time's probably getting limited, but we wanted to make sure, our president wanted to make sure that we were safe when we went back to Annapolis. And after many months of bringing in the best environmental and health experts, because we had to make sure that the airflow in the environment was okay for reducing transmission of the illness. And so that was a part of the overall plan that was developed, that we could go back to Annapolis, the Senate would go back, We would meet in the Senate chambers, but in plexiglass cages. We would be wearing our masks all the time, as long as we were there, and we would distance, and we would be tested twice a week, both the quick test and the one that's in 24 hours. So we had to be tested and had to be negative before we went into each chamber session. So that's how we managed to get through the session. The House did not do that, but that was one of the reasons we did that. Somebody asked a questions. Thank you very much. Yes, pink. I usually wear pink, and I didn't put that in there. That's an obvious thing. When I first ran for office, I wore true blue, and I thought true blue would be a great color. I liked it, but everybody used blue or red back in those days, back in the 80s. And I didn't win that election. It wasn't because of the color, but I decided if I ever do an election again, I'm doing it my way. So I looked for a color that was a bold statement, that I was a woman, that I could stand up to the rest of everybody. So it's not a pale color, it's a bold, sharp, clear pink. I wanted the men to know that I was female, but I could hold my own at the same time. So I didn't want a light wimpy pink. It had to be bold, and it had to be something that if men were going to wear pink, it would be tolerable. So, and this was long before we did the pink recce for cancer. So I did. I had a hard time getting signs because the color initially faded. There was not a manufacturer who could make my signs where they didn't fade in 4 weeks. And over the past 25 years, we now have signs that don't wash out and don't fade. So stay with it. You might be starting something. So that's been fun. When I campaigned in pink, it was operant and classical conditioning. I thought that if I wore pink on a regular basis, when I pulled the pink away, if people saw pink, they would think Addie. And that's exactly what has happened. So after I stopped campaigning, the first time I showed up in a picture without pink, everybody said, Addie, I couldn't find you. There was no pink. So I thought, forget this. I can wear a uniform. I've worn a white uniform most of my life, except in psych when you needed to dress up a little more formally, which I did in the psych setting. Now we wear jeans. We didn't back then. So that's kind of a fun piece of, it's just part of who I am now, that crazy lady with pink on, or a pink hat or a pink something. So despite COVID, I did a little sidetrack, but thank you for the question. But despite COVID, thinking we were going to have a not so good session, we had a much better session than anybody ever anticipated. Now there's going to be a tremendous debt at the federal level that your next generations are going to have to take care of. But in the meantime, we have a structurally balanced budget. Very excited about that. We had no outbreaks of COVID through this session. Even those of us who lived at the hotel where we left in March of last year on an abbreviated session, nobody at that hotel had gotten sick. Nobody who worked there, none of us had gotten sick, and we all came back and worked through a 90-day session this year. And we were able to have exceed our revenues over our expenditures by 79 million, with the surplus of 151 million in 26, which is unheard of. We are structurally balanced for the first time in ever that I can remember, with 2.1 billion in cash preserved and $1.4 billion in the state's rainy day fund. So if we have another calamity, we are ready. There are funds that are going back to the community, expand. I mean, look at that, 13.5 billion for Medicaid for our 1.5 million residents who need access to health care. 4% rate increase for our behavioral health and developmentally disabled providers, long overdue. We've fought for 15 years for that rate increase. 300 million will be invested in broadband so that in the next 5 years, everybody will be connected. And 300 million will support Marylanders with temporary cash assistance, temporary disability, utility arrearage assistance, and in our nursing homes. And more than 100 million to support our state employees who have been our essential frontline healthcare workers, correctional officers, and police. So that was a unusually incredible session with a lot that we thought would never happen in years. So it's been an honor to serve. And next slide. So there we are. This is the chamber before and after. This, the one view with all the cages. I felt like I was in a forest because, as you can see, when somebody's speaking, it's hard to see them. And but there were cameras actually, and everything in the Maryland General Assembly is available online. So you can go back and look at our hearings. We held our committee voting session in cages in our committee rooms, but most of our activity, all of our hearings were held online. Now, the problem with that is that people could view, but the audience really couldn't be as engaged as before. So I think a lot of the decisions that we made this year were very superficial, and we may have to revisit a number of aspects of our work going forward. So yes, the Maryland General Assembly does convene every year from January to April. It's a 90-day session. And, and what we do, legislation was introduced. I introduced probably about 25 or 30 bills. I had 10 completely passed. I had 4 integrated into other bills, particularly the telehealth and broadband bills. I worked on those. I wasn't the lead sponsor, but I crafted the amendments or helped craft the amendments with the advocates and businesses, and worked on getting CNA credentialing a little bit easier and quicker. Worked quite a bit with the Board of Nursing, worked with the oversight of nursing homes to make sure that if an out-of-state company comes in and buys a nursing home, they need to have a site visit and an inspection to make sure that if the previous owner had met a quality standard, the new owner would be expected. And we wanted to see that they were maintaining that same element of quality. I do a lot of work with preceptor tax credits as a way to offset the volunteer service that our doctors and advanced practice nurses provide for students. And we want to continue to be able to provide some scholarship and funding to assist all folks who want to go into healthcare to go into healthcare. We really need more, diversity in our healthcare team. And we need more healthcare providers in our rural areas. We still have difficulty with psychiatrists and advanced practice folks, dental care, primary care. So I'm hoping in the next 5 years we can have get to our residency training program and eventually do kind of a mini med school down in the Salisbury area so that folks do not have to go off the shore for their clinical. Clinical is always going to be an issue, but with a lot of the telehealth and telework, I think there's going to be expanded opportunity to be able to practice and get that clinical experience that's so vital when developing a practice. So, excuse me. But I hope maybe you'll have some questions. I don't know if we have some times for questions, but that's essentially in an hour, a little bit of where I've been and where am I going? Well, tell you, here are a list of my health priorities for this year. As you can see, telehealth, access to care, addressing health disparities, behavioral health, and then our occupation boards. I have others in addition to that, but they're the main ones that we worked on this year. And that's a recent photo of recognizing a team of watermen who had a very quick response to a man overboard and were able to get him out of the water after it was cold water. So it was in, I think it was in February this occurred. A guy, hit bad storms, and I think one piece of equipment on his boat pulled him over before he knew it, but he's safe. And we were recognizing them up in our very one rural part of the district, Tillman Island. Once again, thank you all so much for the opportunity. That's a lot of information, and I may have missed some of the obvious, but it's been my honor and privilege to serve in the Maryland General Assembly and to work as a healthcare professional. I think there is no greater opportunity for service and caring than to be engaged with folks at a very vulnerable time of their lives, and to be able to reach out and make connections, to be able to help folks realize that they have something very special to share with others and with the world and be involved. So thank you all so much. And Manal Hill and Dr. Shima, my privilege.
Thank you so much, Senator Eckardt. That was truly amazing. I can say, I learned so much from your life journey, and that was truly amazing. Really appreciate it. We do have a couple of questions from our students, and I'm going to pass it off to Zay to ask the rest of our questions.
Thank you, Manal. Thank you very much for that incredibly informative session, Senator Eckardt. My name is Zaid, and I'm a rising undergraduate behavioral sciences major from California. To start off our Q&A, one question we had was, which communities in America do you feel are the most disadvantaged in terms of health disparities and unequal access to proper healthcare? And what are the key initiatives to addressing such health disparities?
In our area, I look for, and we're able to get that data now, to where various areas of poverty, designated areas of poverty are. And we're able to break out, because of the system that we've developed in Maryland, we knew how many people were eligible for medical assistance because of income and where they were. So you can use the census tracts to do a lot of that. And of course, when we do the census every 10 years, then we're able to move that down into specific zip codes. So what we are working in Maryland, we've been working for years to be able to make sure all families have access to health care. So ever since I've been in the Maryland General Assembly, we've added children. We've added all children have access to health care in Maryland. Then we've added families. We added those individuals who are incarcerated or in jails or detention centers, because once you go into a jail or detention center, you do not have funds. So when you come out, you do not have funds. So if we expect people to re-enter into the community, you have to have access to health care. And that has to be done before you are released. So now we have programs that we're working to integrate folks as they come out of jails, prisons, and detention centers. And many times those individuals are parents of children. So there needs to be reunification and reentry. So we've done a lot of programs around work, healthcare, and wraparound services for the family. And we're working on a model called 2Gen. It's 2 generations where we work with the whole family. So you might have grandparents, you might have grandchildren, you might have a whole series of people in a family in some of these designated poverty areas. And that way, if we wrap the services around the family, rather than having the child go to children's service and the person coming out, the father's coming out of jail, get services through corrections, let's pull that all together and be able to wrap those services around. So that's a new model that we're working on now through our Department of Human Resources, but all of our health department, corrections, children, youth, and families, all of the other departments as well are well schooled in this new approach of integrating services. So that's one way I think that we're going to begin to make a deliberate effort to interrupt poverty. And then our local management boards, there's something called local management boards, which are responsible for children at risk and their families. That is how they have the opportunity to be embedded in the local areas, in the communities, in our counties, in our cities, to be able to implement this 2Gen approach. And a lot of times and I mentioned, we started in our jail, teaching our fathers fathering, getting them involved in yoga, which may sound kind of interesting, but the folks loved it. And then we were able to bridge that as they went into the community and providing support to them as they worked with their family and were able to secure employment.
Thank you. Another question we had was, did you find it difficult to transition to working in policy after spending the majority of your career in the clinical setting?
Interestingly enough, as a clinical nurse specialist, my role was kind of in the middle. So what I would need to do and did on a regular basis was to make sure that my staff understood the law that drove their practice, and that when there are changes at that policy level to the law that don't fit, that's when you work up through that local level, that lower level, frontline level, up to make that change in policy. And I share that sometimes, and a lot of times, yeah, I tend to want to work alongside the executive branch of government to help them translate that. So I guess as a clinical specialist, because I've learned how to work as an entrepreneur rather than an entrepreneur, somebody who works within the system. So I usually am able, but that's helpful to me because I can find out who in any department is responsible for what. And then as a policymaker, go to that person and see how it's being interpreted there, but keeping the person who's the top of the line engaged in that conversation. Does that make sense? If I go to the person that I know in the department that handles that, then I don't have to go to the top and then down through the ranks, and it's quicker. I just get permission from the department heads to find out who I can go to. Now, if they say you have to go through our government relations person, that's how we operate. But you build those relationships to be able to give feedback to the departments about what is not working on the ground.
Thank you. And now for our last question, how did you find the work treatment of being a nurse? And was there equity between doctors and nurses at work?
No. It depended. It depends. It depends. Earlier on, a lot of the physicians expected us to do a lot. One of the things I found back in the 80s that I was willing, because I was doing some independent practice, I was willing to work with the clients that the other physicians and psychiatrists didn't want to work with. If they were poor, difficult, I mean, hard cases because of complex diagnoses and particularly non-compliant. I mean, non-compliant is a judgment word that you're not willing to do what I tell you to do. And, for nurses, we like to find out what that's all about, because there's usually something going on that people aren't appreciating what needs to be done. I mean, we're doing that right now with the vaccine. There's a lot of vaccine resistance, but I can't go up and make somebody get a vaccine. And I don't know if we want to get to mandating it, although that's what usually happens if people don't comply. You have to put a helmet law in place, or you have to put a seatbelt law in place. We didn't want to put a mask law in place, but some places are doing that. Businesses voluntarily are saying, you don't come, if you want to come into our store, put your mask on. If not, stay away. I mean, that's the better way to deal with it. So, we'd like to find out what people are thinking about the vaccine, and try to educate and inform and continue to build the relationship so that you can identify trustworthy people to provide the good information. But there has been through the years. I think it's better now. I think folks seem to be working in a more interdisciplinary sharing, teaming. That was the one thing I did like about psych mental health, because the law in Maryland prescribes the treatment team, a psychiatrist, psychologist, social worker, nurses, OT, activity therapy, nutrition. All of those players are at the table and have a part of the assessment and the overall development for the plan of care. And I think as we move forward with doing our multidisciplinary teams, we bring again, I just think there's value in diversity. I mean, it's a diversified team. Everybody brings something to the table and recognizes each's area of expertise, and we're able to move forward. I think it gets better when we're able to do that.
Thank you very much, Senator.
Welcome.
Yeah, thank you so much, Senator Eckardt. We truly appreciate you taking the time out of your day to mentor us through your field and your incredibly inspiring life journey.
Oh, I love the word picture. Thank you. My pleasure. And the best to you all in your careers. When you get to your career, you ought to drop me a note to tell me what you're doing.
Thank you.
And stay healthy, wear your masks, distance, get the vaccine. I can't tell you that enough.